Hi, my name is Dr. John Repole. We're talking about biotoxins today, and those are toxins that are alive, like viruses, bacteria, protozoa, fungus, and yeast. Just to put this in perspective, the #1 killer worldwide are related to infectious diseases. In the United States, we have a little bit of a different story because in the United States, most of the diseases that we're dying of are related to diseases of diet and lifestyle, like heart disease and cancer and diabetes. But in the United States, most of the infectious diseases that people are suffering from, whether it be H. pylori or Lyme's or mold, is significantly contributing to somebody's disability rating, meaning their quality of life or their aging process. So if we look at some statistics, like Lyme's disease in the United States, there's about 30,000 cases that are reported to the CDC every year. But if you take into account the unreported cases as well as the reported, the estimates are closer to 300,000. And if you take a small segment of the population that is suffering from, like, say, chronic fatigue syndrome or fibromyalgia, and if you dig a little bit deeper, you're going to start noticing on a small segment of these population that, #1, they're suffering with autoimmunity, but also they're suffering with some sort of infectious disease. And in this case, there would be an example of Lyme's disease because it comes with such a host and a myriad of signs and symptoms. If you take mold, on the other hand, and you take a small segment of people who are suffering with chronic sinusitis or chronic asthma-like conditions that just seem to, there's no effect, with the treatment protocols that are being used, and you dig a little bit deeper with them, what you start to notice is that these people, when you do some of the testing, they're actually suffering from mold toxicity. And so we're not saying that every case of chronic sinusitis or chronic asthma or fibromyalgia or chronic fatigue syndrome is related to Lyme's or mold, but we're saying that it definitely needs to be put in the differential diagnosis with patients. So before we move forward, I just want to make a distinction between 4 different types of infections. There's primary, secondary, co-infections, and then the last one would be opportunistic infection. A primary infection is exactly what it sounds. You get an infection like a cold or the flu or hepatitis or some sort of sexually transmitted disease. A secondary infection would be you have the primary infection and now you go to the hospital and now you are exposed and you get a staph infection. That would be the secondary infection. A co-infection, a lot of times people explain them like a dirty needle. So let's say the vector that is carrying the Lyme's bacteria, which is a tick, inserts its quote-unquote needle into the person's body, but because it actually is dirty, it's coming with other types of bacterial infections. Some of the most common ones are Bartonella and Babesia that come along with the Lyme's bacterium. And so those would be co-infections. Opportunistic infections are distinguished really from the first 3, which are really from the outside in. And an opportunistic infection is really from the inside out. In other words, given the opportunity, things that are already within our body, like yeast or bacteria, begin to grow. And so why would they grow? As an example, if we're eating a lot of sugar-laden food and we're not taking care of ourselves with the diet and our blood sugar is going up, that's going to increase the amount of yeast production in the body. And when that happens and you get it's circulating throughout the entire body, you get a systemic condition called Candida. Or if the bacteria increase in our small intestine, that's called a condition called small intestinal bacterial overgrowth. Some of you, you've gotten the chickenpox virus. The virus is basically a piece of protein. It lies dormant within the spine, and then given the opportunity, which is usually some sort of immunocompromise, then that virus basically comes out and begins to wreak havoc. But there's usually an opportunity that has brought about that virus to come forward. So now, when we look at, say, Lyme's as an example, there's 3 different phases that we can look at it. There's the acute phase, the chronic, and the autoimmune/opportunistic, which is what we'll refer to as the 3rd phase. So the acute phase is pretty simple. You get a tick bite, and it is bloodborne, It's cellular, meaning it's outside the cells, it's easily detectable, and your immune system mounts a response and is trying to take care of it. This is when you go to the doctor and you get a round of antibiotics and all is well. Let's say though that after the round of antibiotics, a month or so later, you start getting more symptoms. Some of the Lyme's bacteria began to hide, and so they got smarter. And this enters now into the chronic phase. People could also enter in the chronic phase because most of the people who get Lyme's disease don't even know that they were bit by a tick. Most of the people, less than a quarter, don't even get the classic bullseye rash that sometimes is associated with the tick bite. And so they don't even get treated with antibiotics, period. But what happens is the Lyme's bacteria get smarter, they begin to hide. And so they go from extracellular to now intracellular, meaning they hide within the actual cell. They also have a way, and so do bacteria and yeast, to make these biofilms. So they start squirting out these little proteins that make this slimy matrix, which allows them to commune in, which allows them to also go undetected by our body's immune system. And they basically harbor in there until all is okay, antibiotics are gone, and then they rear out their ugly head and they start wreaking havoc. Now, if the chronic case goes even further, you begin to get autoimmune related issues, meaning our body begins to attack self. Why? Well, if it can't find them, it's still making the antibodies against them, and so either it attacks them, it sees them, and then there's friendly fire and it starts shooting at other parts of the body, or let's say it's harboring in joints or tissues in the body that it basically can't get to. It goes and attacks that tissue anyway, and so it begins to have this autoimmune component to it. But when you get into this chronic stage, which we typically don't see the acute stage, we usually see chronic or we'll see this autoimmune related stage. And so when you get into this chronic stage or this autoimmune stage, it really is in essence opportunistic. So this brings us to the old question of, is it the bug or is it the environment? Two people in a room, one person is upright, it's vibrant, it's healthy, and the other person is depressed and their face is down and they're just not eating healthy. The virus enters both of their bodies. Who's the person more likely to have signs and symptoms related to the virus, right? The answer is, of course, the person with the compromised immune system based upon their diet and lifestyle as an example. We also know that you can take two people who are objectified, have Lyme's bacteria in their body, and one person has 0 symptoms and the other person has a whole myriad of symptoms, right? So, like with the Lyme's, there's this triad of symptoms that sometimes people come with, and it's just this, unrelenting fatigue, brain fog, and a hallmark is this migrating musculoskeletal pain or joint pain. So one day it's in the knee, the next day it's in the ankle, and it's in the back, and and that's why there's a lot of diagnoses of fibromyalgia, because they have kind of similar signs and symptoms. Lyme's symptoms, however, are all over the place because the Lyme's bacteria affects the nervous system. So I mean, the host of symptoms that people can present with is quite unique, and that's where we're getting at. Louis Pasteur came with the germ theory, this idea that before then we used to think that it was just spontaneous evolution of germs that came within our body. But since then we had this understanding that now that there are certain bugs that actually can create certain diseases. On his deathbed, which is kind of an interesting story, there was a big fight that he had with a guy named Antoine Bechamp, who really proposed more that it's the environment and not the germs that really are causing disease. And Louis Pasteur, whether it's true or not, is reported to have said that no, it's the environment. In other words, what's really important here initially, in treatment protocols, which we'll talk about in a minute, is really the environment that these bugs are harboring in. And so that's where we really have to kind of make a distinguishing factor when we're looking at this. So with the Lyme's, when it's moving into this autoimmune phase and then into this opportunistic phase, treatment, yes, should be targeted at killing the Lyme's bacterium, but also understanding that if you're in this chronic nature or this autoimmune or this opportunistic, that we really need to focus in on the foundation of diet and lifestyle first as a primary vehicle. diagnosis is confusing. So, there's a two-tier system for Lyme's disease. There's the ELISA test and then the Western blot. There are some companies called IGeneX, which do like a more advanced type of expanded Western blot. And the CDC has a criteria that you gotta have 2 out of 3 bands and 5 out of 10 bands in another test in order to have a criteria for the Lyme's diagnosis. These tests are just not accurate. And so, yes, it could point us in a direction to get a diagnosis of Lyme's, but let me just explain what these tests are actually testing. They're testing different protein of the bacteria. So let's just say that, if we give just an example or an analogy here, it's testing for a part of my finger, a part of my hair, a part of my chest, a part of my back. And so if you have 5 out of the 10, right, then you can make a diagnosis, of Lyme's disease. But the thing is, a lot of these bacteria share a lot of these similar protein structures, and so it's quite possible that what we're looking at is another type of infectious disease that just might not be a named diagnosis. Other tests that are used are what's called the CD57 panel and the complement protein. And sometimes doctors, just by that test, will diagnose somebody with Lyme's or have a mold infection. And that's also not appropriate, because what it's really telling you is that there is a complicated infectious disease within the body. It may be more in line with Lyme's, it may be more in line with mold, or it could be just an unknown, undiagnosed infectious disease. And so we have to kind of put in perspective, and it's really important to get these tests, but then to look at them in the context so we don't start labeling people and making people think that they have certain types of diseases that they don't really have. So that's a really important part. With mold, there's lots of companies, but really one of the premier companies in the country is a company called Real-Time Laboratories, and they can test for some of these more hidden type of infections for mold. And of course, you'd want to get your house tested as well. So treatment. If we kind of move into kind of more of a treatment approach, one of the best ways to monitor, especially with mold and especially with Lyme's, is to actually look at these complement proteins in the CD57 panel, because that will tell you if you're actually making progress on that. So we look at treatment. Diet is critical. A whole food plant-based diet, in my opinion, is the most superior way to get the autoimmune condition to go down, to get the inflammation of the body down, and to help with some of these chronic conditions, because in essence, if you're eating lower on the food chain, you're decreasing the inflammatory load that's on the body. So diet plays a critical role, and in some cases, that's all that's needed for certain patients. Depending on the chronicity, if the person's had it for decades or longer, right, then you really want to beef up the treatment plan. You have to be really careful with botanicals and other types of nutrients that stimulate the immune system, especially if you're in that autoimmune phase, because what you don't want to do is to stimulate your body's immune system, and because it's in this autoimmune phase, it actually makes the condition worse. You want to use some antimicrobials, and you want to alternate them so that you don't get resistance. We use a whole host of different types of antimicrobials depending on what the tests come back and what the tests show. We want to custom tailor it a little bit to kind of find out if it's Candida, or if it's mold, or it's Lyme's, or it's an unidentified infectious disease, if we don't think we have enough information to really kind of move forward. We use all sorts of different protocols, like the Cowman Protocol, and different botanicals from companies called Nutrimetics, but they're all basically have one thing in common. They're basic antimicrobials. If it has been found that you have the autoimmune portion of it, you can take a peek at the autoimmune video, but we then initiate kind of the 4R program. It's also important to put into the program compounds and substances that break up that biofilm that we were talking about. There's all sorts of substances that can be used. Some of them are referred to as chelators. And chelators are such as like EDTA or chlorella. They go in, they're actually used for heavy metals, to take out metals from the body, but they do a really good job in trying to break up some of these biofilms. So If you believe that you are suffering from some sort of chronic infectious disease, your tongue is always coated white and you're suffering with constant sugar cravings, systemic candida, and no one really believes that you're suffering from these conditions, or you suspect that it might be Lyme's, but your doctor ran a Lyme's test from just the regular labs and it came back negative, or they ran a mold test and it came back negative. It pays to kind of seek out somebody who's versed in this and in functional medicine to dig a little bit deeper, because I've seen in my own practice it can really make some remarkable changes in people's life. To end with, before you go on this journey and before you're able to get in to see somebody, you can always start with the environment. And that's the take-home message to leave you with. Thanks so much for listening.